Critical care nursing. Today, we're going to demystify what a critical care nursing is all about. Who is a critical care nurse? Now, we have in the studio with us a critical care nurse by name Juliet Ami Kwadzodeh. Today, we are indeed going to demystify critical care nursing. Stay tuned. Welcome back. Today, like I said, we'll be demystifying critical care nursing. And I'm here with one critical care nurse by name Juliet Kwadzodeh. Welcome, Juliet.
Thank you very much.
How are you doing?
Yeah, my
So, who is a critical care nurse?
A critical care nurse is a registered nurse who has been trained in ICU nursing, intensive care nursing, for 1.5 years and licensed to practice in Ghana and anywhere in an ICU or an acute care area. That's a critical care nurse.
Okay, so let's bring the discussion home.
Yes,
what do you mean by an acute
care area? Okay, so when you get into the hospital, you have a recovery ward. After theater, you go to a recovery ward. It's an acute care area. Emergency area is an acute care area. And wards that have got patients who are a bit serious, that is what we call a acute care area.
Is it the same as the ER?
Yes, the emergency is the ER. We have emergency room nurses, but we have the critical care nurses helping them because there's resuscitation. That is bringing people back to life.
So you mean they died and you're bringing them back to life?
And not really. Let's say they collapsed, something like that, so they can come back to life. So
right. So let's start from the very beginning. How did nursing or critical care nursing start for you?
For me,
what inspired you into getting into critical care nursing?
Yeah, for me, during my days in Accra Girls, I was a deputy house prefect, and one of the things I used to do is to send people to 37 when they are sick. So when I get there, the way the nurses and the doctors work, I was actually inspired to do nursing from there. Even though my mom was a nurse, she never actually forced me into doing the nursing. She only suggested, but I actually got the inspiration from the hospital setup when I went into 37. And when I got the inspiration, I actually wanted to train in 37 and no other place. So from school, I bought forms, entered the 37 nursing training school.
Okay.
And then I completed from there. And when you complete from there, you are a general nurse.
Okay.
So I practiced general nursing for 2 years. And during my rotation, so after going to the nursing school, you do rotation afterwards. Rotation means you are going to various departments.
Okay.
And a theater was somewhere I couldn't stand the stress because of the long standing hours.
Okay.
But the recovery room, I realized that people were appreciative when they are in their the most vulnerable state. I mean, after surgery, you can't do anything. You call for water, and you have somebody giving you some sips of water to drink. I realized that was more helpful. Again, I practiced a bit in an infectious ward, that is the HIV, the gastro, and I realized that it was just simple things. It got to a point, it was just simple things for me. I needed something that was advanced and more challenging, more complicated, something that I would think. And so I scanned through things, I asked a lot of questions, and critical care nursing was the answer to mine.
So when you're in the ICU, typically, what would a critical care nurse do in the ICU? Okay,
so we provide optimum care to both the patient and then the relative. When I say optimum care, it's like you are depending on a machine for breath. You are depending on the nurse for food. You are depending on the nurse for care.
Okay.
Personal care. So what I do in the ICU is to think for you, put myself in your position, and let you behave like a normal human being will behave. So if you have to bath, I have to schedule. And if I was in that position, I would have bathed like 2 times. So I'll bath you twice, morning and evening. If I have to feed you myself, I eat like 2 or 3 times. I would position your feeding in such a way that you could get something to replenish your body.
Okay.
You sleep and you know that you turn People don't realize it, but when you sleep, you don't sleep in one position for a very long time. You turn periodically. So I have to plan to turn you so that you feel comfortable as a human being. At that moment, the human being cannot do anything for him or herself. And after doing all this, I have to be able to explain to the family members what is going on with their patients. And so we give optimum care. That's why we say we give optimum, everything inclusive.
Okay, so were you trained in Ghana?
Yes, I was trained in Ghana and Kolebu, but lifelong learning. I have a bit of experience from outside just to complement what was being done in Ghana.
Are there a lot of critical care nurses in Ghana?
Yes, for now I can say we have over 2,000 nurses who are critical care because we started training at the school since 1997. And so if we even train 2020 or 30, when you multiply, you are getting somewhere close to 2,000.
Right. So which ailments or which conditions would you consider as critical care, critical ailments?
Okay, so we have multiple organ failures, we have heart failures, we have renal failures, we have the congestive cardiac failures. In fact, it should actually be something that is more progressive. Okay. It's not the simple illnesses that we have. Okay. Things that are more progressive. So
are you saying diabetes and BP are not critical illnesses?
Yes, they are not critical illnesses, but when they progress into the advanced stages, then they enter the critical stage.
Interesting. You know, looking at you, I realized that you have a blue pen, a red pen, and a watch right here. I've always wondered why nurses always have the pens and the watch right on your chest. What's it meant for?
All right, so the red pen is to write night notes. Like, so if anybody takes the book and sees red, it means you wrote it during the night within a period of 8 p.m. to 8 a.m. That's the red pen. The blue pen is notes for the day. So from 8 a.m. to the 8 p.m. whenever anybody writes a blue pen, everybody knows that you work during the day.
So in the event that you don't have the blue pen, you cannot use the red pen in its place.
No, once you use the red pen, it means you worked in the night.
Okay, and the
watch is for it's a breast watch. It's for checking the pulse, so timing, space interval. So that's what we use the breast watch for. And it's a breast watch because the wrist watch is quite infectious because we wash our hands almost every time. So you'd actually infect your watch. So you have to remove your watch and then put it on your breast.
Tell me about end of life.
End of life
within the context of critical care nursing.
Sure. End of life is part of the end of work of the critical care nurse, because for us in the ICU, we always say that it's a 50-50 affair. It's either you're coming back to life or you're ending life. And end of life is one thing that we can't run away from. So what we need to do is to always communicate with the relatives and the patients. I mean, the last thing that a patient will get off is the hearing. So when you are speaking to the patients could hear you, even though they are getting to the end of life.
So a patient has maybe a month or 3 months maximum to live.
Sure.
How would you or how would the doctor communicate that to the patient and their family? How's the protocol like?
Okay, so for the patient, if the patient is conscious enough, you have to explain the condition of the patient to him or her himself and ask him to get somebody he trusts to discuss the matter. So the patient gives us a relative he can trust, and then we discuss it because it's a medical and a private issue. So we discuss the medical conditions with the patient and the relative. Sometimes it gets to a point that the patient is the one initiating the discussion, and then we come in for explanation. But we bring out the experts that are needed here. So for instance, if it's a surgical case or it's you need an anesthetist, you need a physician, we call all of them together in addition to the nurses, and then we discuss the issue as it is. Then we can actually give you the prognosis, that is the outcome. The outcome is whatever will happen after the condition that you have. So let's say you have 3 months to live. We can't tell you it's 3 months, but we'll tell you that you don't have enough time, that your kidneys are failing or your heart is failing. So whatever you want to put in place, you should do that, and try and put family together before you like pass on. So we actually break it down for you to understand it that way.
Is it a tough job?
Sure, it's a very tough one, especially when the person is a human being. I mean, once you're a human being and you're dealing with another human being, the emotions are there. So it's really a tough.
Are there any regrets? Have you ever regretted being a critical care nurse?
It got to a point I was depressed, not regretting, but I was quite depressed because almost every other day you go to work, you have to face the challenge of breaking a bad news to a person. So it got to a point I got very depressed. So I decided.
Is that people were just dying?
Yes, maybe they came late with their conditions. So,
okay.
And when COVID came in, COVID too brought about some others. You will be talking to somebody, and by the time you realize the person is just gone, and you have to actually break the news to the relative, and it was quite depressing. It wasn't regretting, but it was depressing. So we had to get psychological support just to balance our own lives and change the direction of our career. It's the same critical care, but in other areas where
interesting, very interesting.
Sure.
So we're still discussing critical care nursing with Juliet Ami Kwadzodeh. So when it comes to spirituality and science, do you doctors or do you nurses believe that there's an invisible hand somewhere, or it's purely science?
We believe in invisible hands because sometimes you can actually calculate and plan, but it doesn't end up that way for you. So for invisible hands, I'll say yes. We believe in invisible hands, but there is also science, because people have actually structured medicine. They have structured it in such a way that, and it's evidence-based, there's research to show that this is what happens. But obviously there's an invisible hand. I mean, we can't run away from that. God exists, and he does whatever he does. He blesses whoever he blesses and takes whoever he likes. So
you would encourage young people to go into critical care nursing?
Obviously, if you're a nurse, I think that one of the specialties you have to go into is critical care, because it is the same everywhere in this world. I mean, you can't miss out on critical care. I'll say that in this brain drain and in this search for nurses, if you're a critical care nurse, you're on top of issues. I mean, you are highly sought for, and there's nothing that would bring that down, because once we have the science, once we have the research work, once we have the machines existing, and once you have the brains, I mean, that is the highest level of nursing you could get.
All right. So what would be your final words to such people?
Yeah, my final words is that it's a lifelong learning. I mean, every day something comes out. You should be ready to learn more, because it's a very challenging job. I mean, sometimes I go to work and you stand the whole day just to save one person's life. We are very, very happy when we even see somebody wee-wee. Simple things like wee-wee. 20 mils of wee-wee makes people happy. So I think that people should venture into that area. It's struggling, but it's rewarding. It's rewarding,
yeah. Right. So you heard it from Juliet Ami Kwadzodeh, a critical care nurse. I guess today we've demystified critical care nursing, and she's encouraged a lot of people to get into critical care nursing. Thank you very much for watching, and see you another time.